The average doctor's visit is 12 minutes if you're lucky. The nurse walks in, takes your vitals. Then the doctor comes in, sees you for 8 minutes, and the next thing you know, you're at the desk making your copay. And that's not hyperbole. This doctor sees between 25 to 40 patients per day, and there is no version of that where you walk in unprepared and walk out with everything that you needed. In the next few minutes, I'm going to give you the 7 things every patient should do before their next appointment. The prep that catches misdiagnoses, the questions that change treatment plans, and the one thing your doctor's note reveals about your visit that you should always read after you leave. I'm Dr. Robert Freedman, doubly board certified in internal medicine and infectious disease, with over 40 years of clinical experience here in Miami. With my own concierge patients, I am their advocate, but I know most doctors won't do that. So welcome to the things your doctor won't tell you. Here's what your appointment actually looks like from my side of the table. Your doctor walked in with 18 minutes of administrative work after this visit. He or she has already seen 7 patients. Today, he has a child with strep at home, he loves his job, and he's exhausted. None of this is the system's failure of you. It is the system's failure of them. But you live with the consequences. So understanding this, the patients who do the best in that system are the ones who walk in prepared. Not aggressive, not Googled to death, prepared. Let me show you what that looks like. I had a patient. I'm changing the names and the details for privacy. This patient came in with 3 months of fatigue. She already had been to her PCP twice. She was told it was probably stress. Twice she left with no answers. The third time, she brought in a 1-page list. Symptoms with dates, medications, including the supplement she started 4 months ago. The one question at the top, what else could this be? Her PCP read the list, looked at the supplement, and ordered a thyroid panel. The supplement was driving her TSH off a cliff. 6 weeks later, she felt like herself. What changed wasn't the doctor. It was the prep. Here are the 7 things she did you can all do in 15 minutes the night before your next visit. Number 1, before the visit, write down the one thing you want answered. I call that your chief complaint. Not 5 things, 1. The single most important question for this visit. The chief complaint. Here's why this matters. The average appointment gets sidetracked. The doctor walks in, asks you how things are going, you tell them about the new symptom, they spot something else they want to address. And suddenly, the visit that you needed for your original concern is half over. And they're typing about something else, totally different. If your chief complaint is at the top of your notebook, physically in front of you, you have an anchor. When the visit drifts, you look down and say, before we go, I really want to make sure I understand X. The sentence alone, in my experiences, changes more visits than any other. Pick the question the night before. Write it at the top of your page. And bring that page. Number 2, bring a timeline with your chief complaint. Here's the difference. Pain in my back. That's a symptom. And yes, the symptom you came in with. But it really doesn't tell me much. Pain in my back. Lower right back, started 3 weeks ago after I helped my brother move a couch. Was a 3 out of 10 then, now it's a 7 out of 10. Worse when I sit for more than 20 minutes. Better when I walk. No numbness in my legs, no fever. That is a timeline. That tells me what to test for and what to rule out within 30 seconds. Doctors think in timelines, because that's how they make diagnoses. A timeline narrows the differential. A snapshot doesn't. So before the visit, write out, when did this start? What were you doing when it started? How has it changed since then? What makes it better? What makes it worse? Have you had this ever before? 5 minutes of writing the night before will help your doctor get to the root of your problem. Number 3, bring every medication you take. The actual bottles, not a list you wrote, not the pharmacy printout from 3 months ago. The actual bottles. Why? Because the most common cause of a misdiagnosis that I see, and this is true at every level of medicine, is a medication or a supplement causing the symptom that's being investigated. By bringing the bottles in, you are forcing the doctor to look at every bottle and explain why it is being prescribed. Patients tell me, I take a multivitamin, and I don't mention that the multivitamin has 5,000 international units of vitamin A. Patients say, I take a baby aspirin, and don't mention the fish oil or the turmeric, which are both blood thinners. Patients say, no medications, and they're on a steroid inhaler. The bottles don't lie. The label tells them the dose, the brand, the frequency, and when you filled it last. 5 seconds with the bottle catches drug interactions that 20 minutes of conversation misses. Bring the bottles, including over-the-counter medications, especially supplements. They're the silent killers of misdiagnosis. Number 4, have your medical records with you. By federal law, you are entitled to a copy of every test, every image report, every consult note, every biopsy result. They are yours. You don't need a reason. You don't need permission. Most people don't ask for them because they assume the doctor already has them. They don't always. Records get lost. Faxes don't go through. Notes are filed under the wrong patient. A specialist your PCP referred you to in 2024 may not be in the same system as the specialist they refer you to in 2026. Or even more likely, your PCP never received the consult note, and because of how busy he is, he never checked to see and had his nurse call the office to get the actual note. When they see 40 patients a day, you're lucky if they know your first name. Here's what you should do. 1, log into your patient portal. MyChart. Follow My Health. Whatever your doctor's system uses. Most of your records are already there. Most patients use 5% of what's available in those portals. Spend 20 minutes one weekend learning yours. 2, for anything that isn't there, old hospital visits, out-of-system specialists, biopsies from 2019, call the records department directly and ask for a copy. They will have to give it to you. 3, keep them in one folder, a real physical folder, with paper, so you can hand it to a new doctor and they can flip through it at the appointment. The patients with the best outcomes all do this. The folder is small. The impact is enormous because you've become an advocate for yourself and you won't accept mediocrity. In addition, the doctor will be impressed with your due diligence and will be more engaged with you at the appointment. Number 5, bring someone with you. The data on this is clear. Patients who attend appointments with a family member or a friend ask better questions and catch errors at higher rates. When you are at an appointment with a doctor, you can get nervous. You might not be feeling well. And the person you brought in with you is your advocate and will remember things that you don't. A good advocate does 3 things. 1, take notes, not on a phone, on paper. The act of writing slows the visit down in a way that helps you both. 2, an advocate asks the question you forgot. They've heard you talk about this concern for a week. They know what's been worrying you. If the visit ends without addressing it, they can say, wait, what about X? 3. The advocate remembers what was said. You will not remember everything your doctor said. Studies show 40 to 80% of medical information is forgotten within an hour after the visit. Half of what you do remember is wrong. Your advocate is a second brain. None of this means that you are stupid. You are simply not feeling well and in a stressful situation. Can't find someone to go with you? Ask your doctor if you can have your friend on the phone during your visit. The answer is almost always yes. Anybody you trust counts. Spouse, sibling, friend, adult child, someone who knows you well enough to know when something's off. The most important thing is bringing someone who cares. Number 6, at some point in every visit, usually after your doctor proposes a diagnosis or a treatment, you should ask one specific question. What else could this be? The phrase is the single most powerful thing you can say in a medical appointment. I'm not exaggerating. Here's why good clinical thinking includes a differential. The differential is the possibilities based on your symptoms and your physical examination. The doctor will give you the most likely diagnosis, but that doesn't mean it is the only possible diagnosis. When you ask, what else could this be? You are inviting them to share the rest of the list of possibilities. He or she will tell you why he believes that the diagnosis he made is the most likely diagnosis and why the other diagnoses are less likely. You then walk away with a better understanding of your diagnosis based on his exam, and you will feel more comfortable because you now understand his reasoning. But here is the kicker. Sometimes, when they have to explain to you and break down their thought process, they are now forced to go back through the symptoms. They say, actually, let me think about that. And that is where misdiagnoses get caught. Not in the first answer, in the second one, which you force them to think about by making them explain it to you. Therefore, what else could this be? Practice saying it. Use it every visit. It will catch more things in your medical care than any other sentence you have access to. Number 7, before you walk out, you need 3 things. 1, the diagnosis, or if there isn't one yet, the working theory. 2, the plan, what you're doing next, what tests are being ordered, what medications you're starting, what follow-up looks like, what the timeline is. 3, the safety net. What changes in my symptomatology would make this an emergency? When will I hear the results? When is our next follow-up? And before the door closes, ask one more thing. What would make me come back sooner than we planned? That question gives you the threshold for action. Without it, you'll either come back too late or you'll spend the next month wondering if you should call. One last thing. This isn't on the official list. Most patients don't know they can do it. 2 to 3 days later, after your visit, log into your patient portal and read your doctor's note. It's there. By federal law, since 2021, patients have legal access to their clinical notes. Most patients have never read one. The note is what your doctor actually thinks. The conversation during your appointment was what they told you. Those 2 things are not always the same. If the note says patient appears anxious, working diagnosis, stress, but the doctor told you, we'll keep an eye on it, you have a flag. If the note lists differentials that you weren't told about, you have a flag. If the note misses a symptom you mentioned, you have a flag. All of these are reasons to call the office and ask a follow-up question while it's still fresh. Read your note every visit, always. I know this seems like a lot of information, but this is vitally important information for every patient. So let's recap 8 things you need to do. 7 before the next appointment and 1 after. 1, pick your one question. This is your chief complaint. 2, bring a timeline, not symptoms. 3, bring the medication bottles. 4, have your records. 5, bring an advocate. 6, ask what else this could be. 7, plan the exit. Bonus, read the after-visit clinical note. The patients who do this have better visits. They catch missed diagnoses. They leave knowing more. They worry less. If this helped you, I made a free PDF of these 8 things you can print and fold into your wallet. It's at the link in the description. If you know someone who's about to see a new doctor or someone who's been told it's probably stress more than twice, send them this video. It'll save them a year. This is the first video I've ever made on here. So if you enjoyed it and want to see more, please like, share, and subscribe to my channel. I'll see you next time as I bring you more advice to live a better and healthier life. Feel free to leave a comment below so I can address it in a future video.